finish the primary treatment, you've gone through an enormous amount of effort to just get to the point where you make the treatment. But then after the surgery is over, after the radiation is over, you get into this zone where it's very quiet, and you actually, even though it's over, I would say, in my case, you're a little bit more anxious and you're a little bit unsettled, because you're now starting to look at, okay, what's the rest of the future going to look like? You know, one of the big questions is, well, did what we just do, was that successful? Am I going to be dealing with a recurrence? And that brings out a lot of, you know, concern, stress, anxiety.
So the takeaway message is really that the patient needs to know, and the patient needs to share the information with their primary care clinician. And I think it's very important to spend the time at the end of cancer treatment with a cancer clinician, maybe a nurse practitioner, maybe the oncologist, somebody on the team, to go over the details of the treatment that was given. Sometimes when somebody's in the middle of receiving cancer treatment, it's not the best time for them to ask these tough questions, but at the end, it's important to really have almost an exit interview. And in some centers, they actually offer that to patients. A transition visit, a bridge visit, some time where they can really go over the details of the cancer treatment received, ask questions, and then be very clear with a new primary care clinician or going back to a primary care clinician to go over that material as well. I think this is a great time to turn to support groups or to find peer support in some way. What I often hear from patients is that the greatest advice they heard is from others who had faced similar situations. And sometimes I also hear that giving advice to others is also helpful.
Over time, you start to realize that you've got to get on with your life and continue to do the things that are important. But one of the things that was important to me was to realize that cancer isn't a bump in the road, it's actually a fork in the road, and that being able to help some other people go through that and have less problems than I had was something that was worth doing.
I think of the end of cancer treatment and this transition time as a moment of opportunity. So a time when people can really think about ways of enjoying life and staying healthy, so that they can decrease the chance of having other health problems, and actually share this with other family members to give this a chance really to work for not only oneself, but for all the others who we love and share our life with. If you're looking for more information on cancer survivorship, I would recommend that you look at the resources on cancer.net, ASCO's website for the public. We have wonderful information in printed form through videos and blogs, bringing in the voices of experts and patients. And I think we've covered almost every aspect of survivorship. So I hope that you find it helpful.